We're going to transition now and move on to our first panel of the day, which focuses on understanding and addressing inequities from a systems level perspective. As we're transitioning, I want you to know that we put links into the chat box for a couple of memos that have been prepared in collaboration with ASPE and us at IRP. These are also on the webpage. Okay, and now on to our panel. We're thrilled to have joining us Margaret Simms, who is a PhD in economics and has been a leader at the Urban Institute for many years. Her work focuses on low-income families with an emphasis on employment and asset building. And I will turn it over to her to introduce the panel. Thank you for being with us, Dr. Simms.
Thank you, Catherine. As we know from our introduction today, we're looking at how the goal of human services programs can be achieved in a way that we are not that we are equitably providing them to families in need. And one of the things that we focus on in the first panel is the fact that there may be something in the system, that it's the systems in which the services are provided, that inhibit equitable access for individuals and families in need. So we will look at it on this panel from three perspectives, looking at how these services might be inequitably or equitably provided in terms of race and ethnicity, gender identity, and developmental ability. Following each brief presentation, we'll take a few minutes to address any technical or clarifying questions which you should put into the chat. After all presenters have spoken, we will have a group discussion followed by Q&A on audience questions, time permitting. So I will just briefly introduce the three panelists, as you can see on the screen, and then they will make their remarks in the order in which I introduce them, and then we'll all come back for a group discussion. Our first speaker is Bradley Hardy, who's an associate professor at Georgetown University. And following his presentation, Kimberly Mills, who is Senior Executive Director at the University of the Virgin Islands Center for Excellence in Developmental Disabilities, will make her remarks. Finally, Ellen Kahn, who is the Senior Director of Programs and Partnerships at the Human Rights Campaign, will give her remarks. So, starting with Bradley, welcome.
Thank you. So I'm happy to be able to join the panel and to discuss some of these issues of inequality across a range of dimensions. And so, just before I get into the brief presentation, part of the idea that I want to broach is that there really is this, rather consistent, strong historical sort of pattern to state and local differences in public finance, frankly, taxation, as well as just the broader provision of public goods. And so, to really understand these differences, ultimately, I think that you're taking sort of a more historical look. And certainly in my co-authored work with folks like Trevon Logan and John Parman, we've taken that more historical assessment of the provision of public goods and taxation choices. And many of these patterns are strongly associated with race and region. And so, at the same time, for this group, we see that the consequences in many instances are elevated poverty rates, higher levels of local and regional inequality. And so, I'll move to the next slide and show you a little bit about what we're looking at. In co-authored work with Alex Cawthorn Gaines, who's now at the JP Morgan Chase Policy Center, and Justin Schweitzer at the Center for American Progress, we were trying to kind of do a quicker snapshot, drawing on some prior work I've co-authored, really thinking about some of the associations between state level policy choices, racial demographics, and region. And so, in many ways, we're building off of the work of folks like Watkins Hayes, also work by Marion Bittler and Hilary Hoynes, Zach Parolin, among many others who've thought about really how race looms as an important predictor of spending choices, and then how clients will oftentimes be treated within the system. And so, just to first start off, kind of a well-documented stylized fact that, unfortunately, we do see, differences in the generosity of a range of social welfare programs. Here, we're talking about the TANF program, where, we do see, even adjusting for prices, that, look, states within the Southeast and states in parts of the West are oftentimes less likely to have as much generosity in the form of cash assistance. Next slide, please. But then specifically, when we look at where, for example, Black Americans reside in the United States, Black Americans are disproportionately within the Southeast. Hispanic Americans are disproportionately, in the West. And so then we're also finding that many of these population groups are situated within states and within regions that are on the margin of cash assistance, seeming to provide less. And so, this has been looked at a number of different ways. We're not necessarily, finding anything brand new, but we're trying to think about this and think about the interplay of region and race. And so, again, this is a high-level snapshot. If anything, there's important differences that are occurring at a local level and even within regions. We certainly have some relatively lower performing regions that have states and cities within them that are really on the cutting edge of doing a lot of fantastic things for their population. But it does call into question really this broader federal-state relationship. I should say that in this assessment, we were looking over the 2000s with our data analysis. We drew data from the University of Kentucky Center for Poverty Research, as well as many other publicly available data sources. And again, this report can be found on the Center for American Progress website. Next slide. And so, I think there were some well-publicized state-level differences in the, the provision of and the adherence to federal unemployment assistance benefits and whether states were participating. And again, I think this is a constant tension in terms of really wanting states and localities to administer their own programs in the way that they see fit. And at the same time, there is a broader federal mandate to provide insurance and protection for residents. And frankly, given the arc of history in the United States, there's a well-documented link for many minority Americans for federal protection, right? So there might be instances in which federal policymakers continuously assess what's occurring at the state level. I was very much motivated by conversations with colleagues at Brookings, as well as a Hamilton Project report from 2016 by Bittler and Hoynes that started to document the ways in which it might have seemed that some states weren't really putting money into basic assistance, perhaps in ways that might have been intended many years back, right? And so constant reappraisal, constant kind of reassessing of how things are going. So with that, I'll move to the next and final slide. Certainly right now, there's quite a bit of exciting activity in the domain of historically large expansions of income assistance through the tax system. And I think that many observers of poverty trends are excited about this development. But I want to call attention to the need that still remains for social service workers and others to team up to make sure we get the most out of these benefits. Nathan Anderson at the Federal Reserve Bank of Chicago actually looked within the Fed's 7th district, the set of states that the Chicago Fed serves. So these are states like Iowa, Indiana, Michigan, Wisconsin. And in his analysis, he essentially found that at the zip code level, if you looked at, basically these areas where you had kids that were eligible but not registered, or, actually in tax filed households. So basically they were eligible for these very generous child tax credits, but they aren't actually able to receive them. You found that probably predictably, many of these neighborhoods were majority minority, and a disproportionate share were very low income neighborhoods. And so it just suggests that, again, we have a policy in place where the intent is in the right direction, but many of our families haven't connected to the tax system. And so we're going to have to do more work to make sure they're adequately connected so they can receive these benefits. And so, again, it's teaming up, it's bringing everybody on the same page here. And so, just to close, certainly the weaker safety nets at the state level are a potential threat for both regional inequality and racial inequality. And I think there's just going to have to be continued efforts to bring all parties together to make sure our families can receive the benefits that they qualify for. So I'll stop there. Many more people to hear from.
Bradley, I see one question in the chat, which you may choose to address: how do lower benefits interact with administrative burden and underfunded agencies, that is, those with insufficient staff, et cetera, to affect client?
Yeah, I think it's a great question, and it's something that certainly my colleagues at Georgetown, Don Moynihan and Pam Hurd, have thought about very much in the context of just administrative burdens, that the broader notion that, look, folks are interacting with these social service agencies. I think, at times, encountering all sorts of frictions, be it something as simple as the design of different application processes, hours of operation, how these sorts of barriers, intended or unintended, can sort of combine to make the take-up process that much more difficult. Now, I think that one of the things we saw during the pandemic, I know we saw it in my home state here of Maryland, was that many of the systems that we had that were stood up to process applications were just simply not up to the task. And so it does raise the issue more broadly of, the need for modernization. And I think this is certainly something that probably spans regions, right? So, absolutely, I think this is probably, in essence, to Catherine's question, maybe an understatement of the problem, just looking at state level, correlations.
Well, thank you, Bradley. I think that we will come back to this in the group discussion, because you're right, these are not unique to one particular support system. Actually, next will be Ellen Kahn.
Greetings, everyone. I'm really grateful to be a part of this very important discussion. And I'll be focusing on equity and inclusion for the LGBTQ+ community. Before I dive into a few slides, just to speak to the acronym LGBTQ+, I think most folks know LGBTQ. That's often more familiar: lesbian, gay, bisexual, transgender. The Q was added by most organizations doing LGBTQ work a few years ago to represent queer, which is an identity that was kind of reclaimed and is really very commonly used now, especially for folks under 40. And the plus is really to, just to make clear that there are many ways folks identify that are not captured in the LGBTQ acronym. That could be folks who are pansexual, gender non-binary, gender fluid, same gender loving. And it's really just a way to recognize that the ways in which people, especially younger generations, are self-identifying are more expansive in use of language and terminology. If you go to the next slide, just to sort of level set a bit, I can't tell you how many times I'm asked, and folks in my organization are asked, well, how many people are we actually talking about? You'll hear me mention a couple times today that the lack of uniform collection of data on sexual orientation and gender identity leaves us a little bit less prepared to answer that question. Although we do have a couple of really good data sets, including some from the CDC and some others that I'll mention. But based on the most recent data we have, approximately 5.6% of US adults identify as part of the LGBT community, and about, from another data set, about 2% of high school age children, high school age youth identify as transgender and non-binary. What we see is that when we're surveying younger populations about their sexual orientation or gender identity, we see a higher number self-identifying as part of the community, and my generation and generations that are older were less likely to identify. You can see by one of these bullets that just among Gen Z folks, nearly 16% are identifying as part of the LGBT community. It's not that there's something in the water suddenly. I think it's kind of a change in attitudes. It's a change in how many LGBTQ people we see who are out in the arts, in politics, in athletics, and the sort of possibility models, and the younger people especially feeling a little safer and more empowered to self-identify. So it's really just that there's more opportunity to self-identify. We also see a drop in the average age of coming out over the last 20 years or so, where folks were more likely to come out in their early 20s, whereas right now young people between the ages of 14 to 16 are coming out as LGBTQ, certainly even younger than that as well. I think that, so you can go to the next slide. There's a I think roughly a conservative estimate is about 14 million adults are LGBTQ, but estimates as high as 20 million, and 2 million children and youth. So we know that LGBTQ folks are in our systems of care. They are our colleagues. They are part of our everyday lives, whether we know it or not. Then we have some data from the CDC from a few years ago that gives us a better sense of poverty rates in the LGBT community. And you can see that overall, among LGBTQ adults, there is about a 5% or so higher poverty rate than their non-LGBTQ peers, and struggling most are transgender individuals, with nearly 30% living in poverty. You can also see from this slide that the wealth gap in our country applies as well in the LGBT community, and that Black and Brown and other people of color who are LGBTQ are more likely to be experiencing poverty. If you go to the next slide, you'll see how the intersection of identities that have to do with race or sexual orientation, gender identity, put people at even greater risk of poverty. This is kind of a summary statement from the CDC data. I might also mention briefly that the Federal Reserve Board's survey of household economic decision-making, known as SHED, for the first time in 2019, gave folks the opportunity to self-identify their sexual orientation and gender identity. And about 6% or so of respondents did identify as LGBTQ. And you could see higher rates of using food stamps and housing assistance in that population. Next slide, please. I think we have to point out that there are some structural and legal challenges. We have inequality. We don't have federal law that protects people on the basis of sexual orientation and gender identity when it comes to housing, when it comes to public accommodations, employment, federally funded programs. We also have a patchwork of laws across states and municipalities. You could live in a little blue dot in Alabama, for example, Birmingham, that has non-discrimination ordinance, and in other parts of the state, you don't have that level of protection. Another big driver is that we don't have routine and mandated data collection on sexual orientation and gender identity. So we can't get the fullest picture of what the needs are and how to best meet those needs. And of course, we don't have certification and accreditation and licensing standards that really mandate that any licensed professional or organization that's certified or accredited has to explicitly be inclusive and have explicit learning objectives around LGBTQ populations. Next slide, please. I think I'm running out of time, so I'll try to be very quick here. At the institutional level, often it's a lack of leadership, absolutely a lack of staff training. I heard Dr. Watkin-Hayes mention we don't have LGBTQ community members at the table. We're not engaging that community. And there are concerns about folks who are LGBTQ being out. Are they going to be safe? Are they going to be treated fairly? But certainly, I didn't put it on the slide, but anti-LGBTQ bias is a real thing. You know, a lot of the HIV work that was mentioned earlier happened because gay men, who were the first people we knew of to have HIV and be dying of AIDS, were seen as just, you know, you get what you deserve. People treated gay men with HIV as pariahs. A very anti-gay sentiment has not completely gone away. So bias is always operating. And then the last slide, next slide, last slide. Some practical approaches to creating systems change, explicit policies of inclusion, accountability, training staff and holding staff accountable, providing the kind of skills, knowledge that people need to do a good job, creating welcoming spaces by having inclusive intake forms, assessment forms, de-gendering as much of your programs as you can, and working closely with the LGBT community as your stakeholders in doing your practice improvement work. I will pass it back to Margaret.
I think we'll just go directly to Kimberly to make her remarks. We don't seem to have any technical questions for you at this time.
Okay, so good afternoon, everybody, and thank you for this opportunity. I thoroughly enjoyed the keynote and my other colleagues' presentations thus far. Kimberly Mills, the Executive Director of the Virgin Islands USAID, and I am located on the island of St. Croix. If you look at the globe behind you, these are the US Virgin Islands pictured. So we have St. John to the upper left, St. Thomas, and then the larger landmass down bottom is St. Croix. So I'm going to talk a little bit about addressing inequities in human services from a disabilities perspective, but it's important to note that, of course, like the first presenter spoke about, people with disabilities, in particular in these territories, are people of color experiencing poverty. As our second speaker mentioned, we're also from the LGBT community. And so the idea of intersectionality is really wrapped up in everything. And so we're just going to address this issue very holistically today, and just really to give a brief perspective of what some of the inequities are that we experience and how they manifest, and how possibly we can carve some ways forward to address them. Next slide, thank you. So just a little bit of background. Sometimes, you know, people hear about the territories, like, where is that? Is that, you know, British Virgin Islands or Martinique, or, you know, so who exactly are we? Well, we are a small, for us in particular in US Virgin Islands, we're a small group of islands located in the Caribbean Sea. But as far as US territories as a whole, we're comprised of Puerto Rico, Guam, American Samoa, of course, USVI, and the Northern Mariana Islands, which include Guam. So, you know, what is a territory? Basically, you know, how did we become a territory? How are we a US territory versus a British territory or French territory or an independent nation? Well, we basically are composed of certainly a landmass, but at some point kind of acquired by a foreign entity. And at some point it landed in the hands of the United States. So it's a wonderful time in history when we're really kind of taking some time to sort of just reanalyze our historical relationships to our history and where we've come from, and really just kind of taking a critical eye and a critical look at some of the systems and institutions and practices that have been in place that sort of have led us to where we are today. Interestingly enough, West Indies, where many Virgin Islanders consider ourselves West Indians, and in many ways that's still a misnomer which was given to us by Columbus, because of course, you remember he thought he was in the West Indies. He thought he encountered, he thought it was in a different part of the world, but interestingly enough, he did land on St. Croix. The indigenous people that were there at the time did beat him back temporarily, but then he came back with more people and more ships and claimed it for Spain. So like the USVI as an example, of course, there were the indigenous people, the Arawaks, Siboney, Carib Indians, and then of course, claimed by Spain, Santa Cruz, which is St. Croix, where Columbus first landed, Holland, France, England, Spain, Denmark, Knights of Malta, the Danish, the Dutch, the Danish again, and then the United States in 1917. So for the US Virgin Islands in particular, we've really only been part of the United States for 100 years as of 2017. And we just had a centennial commemorative ceremony. So I say all this to say that it really is important to remember when we're speaking about territories that right away we're sort of kind of, I will say, not behind the 8 ball because of anything inherently wrong with us or who we are, but behind the 8 ball in terms of kind of how we came into being, how we came in the auspices of the United States. And if you're familiar with some of the really fascinating case law regarding people with disabilities, you see some of the similar language being used to, I believe this was referring to Puerto Rico. There was an 1898 Supreme Court ruling, and they were referring to the people as an uncivilized and alien race. We have can see sort of the similar otherness and othering and demonizing and belittling also of people with disabilities around some of the case law literature that can be found. Next slide. All right, systematic issues related to human services access for people with disabilities. Well, our first presenter spoke quite a lot about poverty, and certainly we know the deleterious effects of poverty. It is important to note that, in our discussion of people with disabilities, we are not only talking about people with physical impairments, possible mental health issues, but also, I guess I would say, co-occurring conditions of poverty. In the United States as a whole, we have a sort of an average national poverty population of around 11%. But in the US territories, it actually doubles. The lowest poverty level for people with disabilities in the territories, it doubles to about 22% and goes as high as almost 60%, 57% of populations living in poverty for some US territories. So as we're thinking about these larger systematic issues, it's poverty, it's institutional racism, it's rural isolation, and of course, all of the myriad of things that happen that challenge the ability for people with disabilities to access various systems. So access to care, when we're thinking a little bit about things that make services ideal, and certainly having access to care and being able to touch and reach these systems is critical. Person-centered planning, I mean, there are so many great movements even coming out of human services regarding increasing that ability for individuals accessing service and family members to participate in these services. Early intervention is critically key, but these are also areas where people with disabilities experience barriers. Integrative and coordinative care service models, no wrong door is an example, best practices, but again, do these systems exist and can people access them? And of course, just access to best practices, best treatment, and facilities and equipment. So I say this all to say that these are all challenges for people with disabilities across the United States. And in particular, they are a challenge for people with disabilities in the US territories. Next slide, please. So regarding unique challenges for people with disabilities, just to give some examples. So one, for an example, we do have access to a State Assistive Technology Act, but our allotment is reduced because we're a territory and probably because of our low population. It is important to realize, though, that we have significant infrastructure and deficit challenges. People with disabilities in the territories are not represented in any data projects of national significance, though there has been some movement to remedy this. Innovative programs such as transportation programs for people with disabilities and older adults are virtually absent from being present in any of the territories. Larger issues do play into this. There is significant systematic and fiscal weakness in many of the US territories. And there are few avenues to remedy when there are sort of systematic inequities identified. It doesn't always mean that they can be remedied, such as an example, consent decrees that are affected but not executed. Next slide, and I'll just wrap up. So possibilities for improving outcomes, just really looking at the systematic issues holistically in terms of the poverty, rurality, and our capacity to make a difference. For initiatives to really make a difference in the US territories, we need strong partners that can address the systematic issues and also walk with us and help us build stronger futures. Thank you.
I don't see any technical questions in the chat. So we should be able to move into our general discussion right now. So if all of the panelists would turn on their cameras. Okay, now I'm going to start with a complicated question. And if you don't quite follow me, let me know. When we talk about many of these programs have kind of two levels of structure. One is a system or a set of rules and regulations that come from the federal government. And then usually there's a state or a territory structure for how people access these programs. Now, I know that the process of making systematic changes in terms of legislation may be a lengthy process. Bradley alluded to the fact that during the pandemic, a number of jurisdictions made a way to make access to services simpler and less complicated because they had to. Can we see at the local or state level more of this kind of opening up of access, and what things might require the federal government to make interventions? You can start in any order.
Well, this is Ellen. This is maybe not the most the best answer, and the two other folks on this panel are much more steeped in this work. But I know in terms of trying to build in explicit language about inclusion related to sexual orientation, gender identity into, let's say, federal databases. One quick example was some work we were doing during the Obama administration, which is a friendly administration to the LGBTQ community, to add sexual orientation and gender identity to the AFCARS database that tracks children engaged in the foster care system. And there was a willingness on the part of the leaders of the administration to do it, but there was a lot of resistance and pushback, certainly in especially in more conservative states, where they didn't want to even ask their employees to have to broach the subject of sexual orientation, gender identity, and couldn't see a way sort of to get to the best practice of how to do that. And another quick example is the Department of Education, again, under a former friendly administration, put in very explicit guidance around transgender students and making sure there's inclusion and safety in schools. Then the next administration just stripped all that language out. And until these kinds of things, whether it's around race or SOGI or anything else, are codified in federal law, it's very hard to get sort of at the state and county levels to really put teeth into it. So I know that at least for the work I do, that's been a bit of a sticky issue.
Anybody else want to comment on this?
I would just add in, certainly we do need that codification at the federal level for just a number of different people and processes and procedures, but we also need a bit of flexibility. Just from a territorial perspective, and in particular from a people with disabilities perspective, but more probably from the territorial perspective. Sometimes the existing infrastructure doesn't exist, and because we lack certain elements, then we're excluded. And so we sort of need both. We need codification and we need flexibility so that everybody can get in.
Bradley?
I just say, absolutely, there's going to be times where we have to continuously monitor. I think in the case of, questions around income support, cash assistance, states that rightly have to plug budget holes, but that in some instances have used that flexibility in ways that were unintended. So, I think a lot of proposals are around creating basically a floor, say around, spending on basic assistance within TANF. That's one example. But like the other speakers make the point, you might take away needed flexibility for some other really well-intentioned uses. So, so it's a challenge. Yeah.
Let's talk about a little more about the issue that Ellen raised in her response, which is about data. What kind of data if we were to affect change that would give more access or more equitable access, how would we know that we'd actually been successful? And in thinking about these data collections and where they need to take place, also this question of sensitivity to people's privacy. In terms, where's the balance between wanting to know everything about a person so we can classify them versus wanting to protect their privacy?
I would just jump in very briefly and say that the first step is going to be to continue to properly fund and support what we're doing fairly well. Let's not take for granted, it sounds super boring, but don't take for granted that the US Census Bureau is actually doing pretty good work on identifying demographic differences. And in some instances, there are projects that try to link and put together survey data with some administrative data, say at the state or federal level, and just to continue to fund and fully support those efforts. I think there's more to be done, but we also have to make sure that we fully support the data collection that's currently ongoing.
I have in the chat a question that kind of raises the issue of how do you it's raised in particular with regard to sexual orientation. So if you add it to your data collection, say in foster care, there's concern that putting the information into the data system might make LGBTQ foster adoptive parents a target, and that states in which sympathetic practice is going on quietly would be pushed politically to become less welcoming. So this kind of says, well, how much information needs to be collected versus, can it be de-identified and still be useful, so that, we wouldn't necessarily know which parents were in a given category.
Right. I totally understand the cautious approach a lot of organizations and institutions have around adding sexual orientation and gender identity to their surveys. I think if it's done as part of a more comprehensive system change approach, where all of your policies, your mission statement, your marketing materials, who you have on staff, that it's really communicated from the top down and across, and all staff are walking the same talk around why we want to know everything about you, and that sexual orientation and gender identity are two characteristics or traits like race and ability and income and everything else. And so I think I wouldn't just start out of sort of just tomorrow we're going to start collecting SOGI data without really looking at the whole system. And of course, some people will not choose to disclose, and we know we'll have a certain amount of inaccurate information. But I do think and we see this we work really closely with Prince George's County Department of Social Services in Maryland. We work closely with Lutheran Social Services of Illinois, and they've put in data collection so that they can do their own, as part of, say, your own quality improvement work, where you're looking at, are we seeing a decrease in how many, Black and Brown clients are experiencing housing instability? That means this intervention is working. Are we seeing a decrease in how many transgender women are unemployed? Well, that means this intervention is working. So yes, I think you could do aggregate and sort of non-identifying, but without the data, I don't know that you can really see the need and make the case for, sometimes a more tailored or specific type of intervention.
Anyone else want to comment on this question?
I'll just jump in. You asked about types of data that should be collected, and very simply, just the data that's linked to outcomes. Data that has historically translated to outcomes, and it can be collected from a number of different places. Sometimes even at the university, through various different research initiatives and projects. And sometimes researchers can share data, and a lot can come of it if it's used well.
Okay, let's talk a little bit more about this question of lived experience that's come up a couple of times during the presentation. Where do you see the greatest need for having people with lived experience more engaged, either in talking about systems change or in helping people navigate systems?
I mean, it's a bit of I want to say both. I think that even the issue of administrative burdens that came up from Catherine Magnuson, some aspects of administrative burdens that clients face are potentially aspects of the system that perhaps well-intentioned policymakers just haven't had the occasion to fully think through because they're not necessarily going through it, right? So, design changes, some of which might be low cost, are going to be informed by clients who are interacting with the system, who, say, in the instance of the work I'm engaged in, are facing temporarily low income or lower income on a more permanent basis. So I think that that's going to be important. I would just also say, sort of related, unrelated, that I think that clients and citizens with an actual lived experience, say for the case of HHS, in poverty or near poverty, for example, are going to be really informative with how we collect information. So in terms of building trust, to be really blunt, there are better and worse ways to approach our fellow citizens and residents and neighbors to ask questions. And I think sometimes the well-intentioned researcher or scholar does not approach that in the most appropriate way and would be really well informed by having candid conversations about what we hope to learn, why we're here.
Yes, that certainly speaks to some of the movement now about how you engage people and how you use people who have the lived experience to help you with designing questionnaires, with developing strategies for collecting information. And that's that's just sort of beginning. How would we think about either informing or infusing that at the state and local level? Is it something that can be done on a state by state basis? Is it something that you would think would need to come down from the federal government in some form or the other?
I know of some federally funded projects that allowed a particular jurisdiction, a county, for example, to test out. And I'm only speaking with my knowledge about LGBT inclusion efforts. I'm sure there are examples around really deepening the race equity work and other communities that are historically excluded. But with my lens, I know Los Angeles County had a grant several years back where they were able to collect data and really look at the different experiences of LGBTQ identified youth compared to non-LGBTQ youth. Perhaps there's a way then to, how do you then replicate that so that, they did it and the sky didn't fall and they learned a lot and then they were able to improve lives. So how do we then maybe, advocating to either at a state level or potentially the federal level to, hold up that practice and provide funding so that practice could be standardized in, say, all jurisdictions.
Other comments on that? So let's get to the you might say the big one, which is, if we wanted to, let's say that HHS, the federal government, wants to make change, but we know that if it involves legislative and in some cases even administrative regulations, it will take time. Are there other avenues or strategies that could be used to speed up some changes that would could be done within the existing legal structure for the programs?
I'd love to just jump in and take a stab at this. I like this. It's a sort of high impact, low effort, or big outcomes for minimal funding. I think in the field of sort of stress management and mental health, we know that, and this is empirically qualified, breathing, deep breathing, it goes a long way. So in issues of poverty and racism and school to prison pipeline issues, well, what the research tells us is mentorship and literacy. So I'm just sort of thinking about everything. And that kind of goes back to something our keynote speaker talked about. The thing that made the difference for that woman that was HIV positive was finding that supportive group. So there are inexpensive things that can make a big difference, but I'll just speak from the disability piece. I think, we have advocates at HHS that are sort of working to find us strong partners so that we can access some of these systems of care for people with disabilities that don't exist, which is basically like mentorship. So that would be a big win for people with disabilities in the territory. Another big win for us, and then I'll pass it on to my colleagues, would just be to equalize funding. Yes, our populations for various programs, our populations are much smaller, but our infrastructure is such, we're at such a deficit as far as infrastructure. It should balance it out, and I'll pass it on.
I guess I would just jump in and say that there are probably some clear opportunities to, again, and I'm thinking about this as constantly reappraising, you're just saying, we had an intent, let's go back and look at how things are playing out. In some instances, it probably makes sense to clearly, retain perhaps some of the basic structure of, say, a block grant, whether or not you like block grants. If you're thinking about something actionable, you could retain that basic structure, but you can still put in place some conditions or some baselines below which you don't permit states or localities to fall below. One example could be the basic assistance category within TANF. That's essentially cash, right? And so, again, I suspect this has been thought about, and I'm piggybacking off of some other work that I've read in this domain, but that's just an example. I would just say, kind of relatedly, the kind of high level analysis that my colleagues and I engaged in through the slides I was showing really probably understate the problem. It is the case that poverty in many respects is going to be a proxy measure for all sorts of disadvantage that's occurring at a community level, at a state level. And, we know that, some of the same localities that perhaps aren't doing as well on the margin of poverty are doing poorly on the margin of sexual orientation and how they treat people. They're doing poorly on how they're treating folks based on their disability status. And now that's a generalization. There's going to be variation within there, right? But the broad trend, probably means that we're understating some of this. Interestingly enough, in our analysis, we don't look at the territories. So, when we're thinking about this, if we were to go back in, the problem's probably even worse. Another caveat is that based on the census region codes, actually we're counting some states as, say, in the Southeast that are really practically more like the Mid-Atlantic. So again, it's just to say that there is a lot here. I'll stop there.
I'll jump a quick win.
Okay.
Sorry, quick win could be just if you, at the sort of organizational level, there are great tools out there for like an inventory of practices related to the LGBT community. I think there are a lot of new tools on looking at sort of a race equity lens. I know that we worked with a disability rights advocacy organization to help them create a disability equality index, so that you really are, you're looking through the lens of all these populations that just continue to face disparities based on race, ability, and SOGI, and look at, your organization's policies, your practices, where are there barriers, both literal and figurative, staff training, I think there are a lot of things that don't have a big money ticket associated with them that can really create a much more welcoming, safe, affirming place for all the populations we're talking about today.
Well, that sounds like a good place to end this panel. It's an ongoing discussion, and I think we've just unfortunately scratched the surface, but we found commonality, as Ellen mentioned, in poverty, but we've also found commonality in the concept of lived experience and engaging people with lived experience around finding solutions for their own problems. So with that, I will pass it back to Catherine, I believe.